This is a patient who has a history of hysterectomy and bilateral salpingo-oophorectomy for what turned out to be endometriosis. Now comes in with some pelvic pain. And as we scroll downwards, we can see that here's the vagina, scrolling upwards from the vagina at the vaginal cuff on the right side, and we're starting to see a mass with ill-defined borders. It's T2 hypointense. The borders look also somewhat spiculated. As you scroll even upwards, it looks like there are T2 hyperintense components associated with the lesion. We can see that the rectosigmoid colon is intimately associated with this mass, and there are portions of this mass that are really inseparable from the rectum. If we look on the T1 pre-contrast fat-saturated images, we can see that a lot of those T2 hyperintense components within this lesion are in fact T1 hyperintense, so there's some hemorrhage in there. And we can also see the components that were T2 hypointense, such as these ones over here, are T1 hypointense. Post-contrast, none of this enhances. And so these findings are a great look for endometriosis that have developed in this patient at the vaginal cuff. We can see the endometrial glands as these T2 hyperintense and T1 hyperintense content. We can see the stromal tissue as the hypointense content. Some of that stuff might be adhesions as well, but we can see that it's intimately associated with loops of bowel down in the pelvis and likely contributing to this patient's pelvic pain.